Hello, I'm Daniel Szpak. I am a clinical research nurse in the Shiley-Marcos Alzheimer's Disease Research Center at UC San Diego. I am the research nurse that performs skin biopsies for a few different studies. So what I'd like to do is give you a little background information on why we do skin biopsies, why they're important, and walk you through briefly the process and some of the indications for why we do that. Obtaining a small skin biopsy from an individual after they consent to the study is very important and becoming more and more important because the small sample of skin that we obtain contains specific genetic information to that individual. And so what we're able to do in the lab is actually test therapies and some study drugs as well that may be able to lead us to treatments for Alzheimer's disease and other diseases such as Parkinson's disease. So it's a very important advancement in science. And what I'd like to do is walk you through a little bit about what the process is and what you may experience when I perform the skin biopsies. As I mentioned, we would first consent the study participant, talk about the risks, any contraindications, and some of the, I'll get into the risks in a little bit, but some of the contraindications would be if a person is allergic, let's say, to the lidocaine and the epinephrine that we use to numb the site. If they have moles or scars in the area that we would perform this, then that would be one of the contraindications for doing that. So what we would do after they consent and after the participant has a full understanding of what we're about to do and they agree to do it, I would clean the site with just regular alcohol pads, or sometimes we use a ChloraPrep, which is a little bit of a stronger cleanser. But for most studies, it's not necessary. I would use regular rubbing alcohol, clean the site. And at this point, I would just wear regular gloves because although the procedure is a sterile procedure, obtaining the biopsy, the preparation for it is considered a clean procedure. So of course, I would wash my hands and put on clean gloves, clean the site with alcohol after assessing it. And assessing the site involves, again, making sure that there are no scars, no moles, the person is comfortable where I'm about to do it. And typically, although it differs for some studies, typically this would be done in the back of an individual's arm, just above their elbow. So on the skin above the tricep. And so we would assess the site and then clean it. And then at that point, I would use a very small needle to inject a little bit of lidocaine, about 0.5 mLs of lidocaine and epinephrine. And the lidocaine totally numbs the site. So you wouldn't feel anything, maybe a little bit of pressure. And the epinephrine actually helps to control the bleeding. There's very minimal bleeding in this procedure, but the epinephrine actually helps, and it's due to that injection of that we don't experience a lot of bleeding. I give it about a minute, and it once the site is fully numb, and I check that by actually using the skin punch biopsy tool, which is a small cookie cutter type of instrument. It's only about 2 inches long. And I assess the site for numbness by tapping on the skin and asking the individual if they feel anything. And I actually go a little bit around where the lidocaine and the epinephrine is not injected, just to make sure that the site that I want to use is fully numb, and the other part of the skin around it, they can still feel. So once that's done, I actually use the small cookie cutter skin biopsy instrument, and in a twisting motion, insert it into the skin. And this takes literally about 2 seconds to do. You may feel a little bit of pressure, but there should be no pain experienced at all. Once that's done, in order to get the small sample, we use sterile tweezers or forceps, pull up a little piece of the skin that I've actually used with the cookie cutter device, and then cut that away with sterile scissors. The samples of the biopsy are placed in a container that's labeled by the study coordinator. And sometimes it's in formalin, sometimes it's in normal saline. It really depends on what the study requires. And then I would hold pressure on the site, just as in any other time. Let's say someone would cut themselves, where you hold pressure on it to control any bleeding that may occur. But as I said, in about the 750 samples that I've obtained, we've never had an issue with bleeding or infection, and I'll discuss that in a little bit. So for about 2 to 5 minutes, I would hold pressure on the site with a 2x2 gauze. Once the bleeding is maintained, or once the site looks as though it's ready for the next step, I would put directly over the site about 4 to 5 steri strips. And these are about 2-inch long sterile strips that go directly over the site. And they serve twofold purpose. They actually keep the site protected, and it also pulls the skin a little bit closer together to avoid any type of major scarring, and we'll discuss that in a moment as well. These steri strips go directly over the skin in a star shape, and once that's done, I would actually fold a 2x2 piece of gauze and place that directly over the steri strips, and then place a clear Tegaderm dressing over that. And then at that point, I discuss with participants any type of any type of signs and symptoms to look for, and then to contact the study coordinator or potentially get further care if they need to. And that would include signs and symptoms of infection. Since we are obtaining a sample of the skin and breaking the skin, there's a potential for infection. However, in all the samples that I've performed, we've never had any issues. And it's a small sample. We use a 3 to 4 millimeter circular biopsy tool. But there could be a potential, just as if you would cut yourself on a hike and you break your skin and you may bleed a little bit. So some of those signs and symptoms are increased pain. You may experience a little bit of soreness the next day, and taking Tylenol or acetaminophen or Advil is okay, but there shouldn't be any type of even moderate to severe pain after the procedure. So if there's increased pain, if there's increased swelling, or if there's bleeding at the site, or if you experience a fever, then we suggest that you contact the study coordinator, but then visit an urgent care center. Because, as I always say, if there's a potential, or rather, if you think something's wrong with the site, then it likely is, and you should really get follow-up care. The other instructions that I make sure that I tell individuals are that the steri strips that are directly over the site need to stay on until they fall off entirely and fully by themselves. This could be about 7 to 10 days. And even if they curl on the ends, we suggest that you keep the steri strips on to protect the site. The gauze and the clear tegaderm dressing that's over the site can be removed after 24 hours. And this is really considered a pressure dressing, the gauze and the tegaderm. So after 24 hours, there's little to no chance that there would be increased bleeding or any further issues. So it's entirely safe to remove that dressing after 24 hours. And we do suggest that the site is kept clean and dry. So the procedure is performed in an exam room at the Shiley-Marcos Alzheimer's Disease Research Center. And it's a very important procedure because, as I mentioned, we are able, for example, for the studies that we obtain skin biopsy samples for Alzheimer's disease, or we also perform them for frontotemporal dementia, we are able to send those samples to the Salk Institute and skin the fibroblasts, or the skin cells that we obtain from the back of the arm, are actually transformed in the lab into neurons. And they contain specific genetic information to the individual and their DNA, which really leads us to more personalized medicine and precise medicine, which is a very important aspect of what we do here, because we can test once, and the process takes a few months after it's sent to the Salk Institute, but the skin cells, or the fibroblasts, are transformed into neurons that again contain the specific genetic information of the individual. And then therapies or study drugs can actually be tested in the lab. And this is really important because large-scale clinical trials that we could enroll tens or hundreds of or thousands of individuals sometimes. It can take a long time to get results. It can be very costly. So this is a very efficient way to test therapies or study drugs in a lab setting. And I think it's going to help us come up with potential cures for Alzheimer's disease and Parkinson's disease much sooner than we would have been able to before. So it's a very important and evolving procedure. And what's able to be done with the sample of the skin biopsy will get us to a much better place in helping cure Alzheimer's disease and potentially Parkinson's. And the whole procedure takes about 10 minutes. So it's a very quick procedure, and we make sure you're safe and comfortable. We really appreciate your involvement and your willingness to participate.